Welcome to the deep dive. Today, we're unpacking a really fundamental part of psychiatric mental health nursing, the nursing process itself. You asked us to explore the core methods used in this vital field, and we've gathered the sources you shared. They outline a very systematic way, really, to approach patient care.
Yeah.
So our goal today is to kind of break down these steps, highlight the most critical aspects, and really understand why they're so essential for providing effective support.
Exactly. Think of this as getting the inside track, maybe, on how psychiatric mental health nurses really approach their work day to day. We'll be focusing on the 6 key steps that form the very foundation of their practice.
Right, those 6 steps. Assessment, nursing diagnosis, outcome identification, planning, implementation, and evaluation. And it's really crucial to remember, isn't it, that this isn't like a rigid sequence. It's much more of a continuous cycle.
Yeah, definitely. Each step sort of informs and influences the others. It's not just a checklist. The nursing process is truly the bedrock, you could say, of nursing practice. It's often called nursing's scientific method.
Oh.
It's what really sets nursing apart as a profession, providing this kind of shared framework and language for nurses across all different specialties.
And it also connects to something really important that came up in the sources,
Yeah.
the role of leadership in nursing.
Oh, yeah.
Registered nurses aren't just following instructions. They're really called upon to be leaders, especially in those critical clinical moments.
That's a great point. Imagine navigating a really sensitive conversation during an initial assessment that takes real leadership skills.
Absolutely. Qualities like professionalism and honesty are vital leadership attributes. They directly positively affect both the individuals in their care and, the wider healthcare team in these mental health settings.
Definitely. So maybe let's really get into that first crucial step then, assessment.
Assessment.
Yeah.
Okay, yeah. This is where it all begins. Standard 1 emphasizes gathering and synthesizing comprehensive health information, stuff that's relevant to the individual's well-being and their current situation.
Yeah.
And when they say comprehensive, they truly mean looking at the whole picture. Right.
Precisely. The assessment isn't just, their medical history. It takes a much broader view. We're talking about their entire support network, family dynamics,
Right.
their cultural and community context, even their personal values and beliefs. And it also looks at their strengths and their individual perspectives on health.
Okay. And building this detailed picture involves several key components. We're talking about things like the mental status examination, which I know we'll get into more detail on later.
Yeah, we will.
The psychosocial assessment, a physical exam, obviously taking their history, conducting interviews, and even using standardized tools sometimes to measure certain symptoms.
And a really important part of this is also verifying, kind of double checking the information you've gathered. You can't just take everything at face value initially.
Right. Verification.
What's fascinating here, I think, is the strong emphasis on a truly holistic perspective.
Yeah.
Nurses see each person as this complex interplay of psychological, social, cultural, environmental, functional, spiritual elements.
Yeah.
Gosh, not forgetting their background, identity, age.
It's a lot.
It is. Even when someone comes in with a physical ailment, the ideal is to consider all these aspects. And naturally, for mental health nurses, paying attention to the patient's physical health is just as vital.
And this assessment piece, it isn't a one-off event, is it? It's ongoing.
Oh, absolutely not. It keeps developing throughout all the stages of the nursing process. The initial assessment might pinpoint the most urgent needs, sure, but
Yeah.
as the nurse works with the individual, the assessment deepens and, new insights can emerge all the time.
That makes sense.
And there's this growing move toward a strength-based approach to assessment.
Ah, yes. I saw that.
Yeah, instead of solely concentrating on the problems, which can be a bit demoralizing,
Sure.
this approach really focuses on the person's inherent strengths and the resources they have available. It can be much more empowering, more hopeful for them.
Yeah, I can see that. And something else that really stood out in the sources was the importance Florence Nightingale placed on careful observation, focusing on facts rather than just opinions. And there's a bit of a concern, isn't there, that these observational skills might be, getting less sharp with our increased reliance on electronic records.
That's a really critical point, particularly in psychiatric nursing. Observation isn't just about, collecting data for a diagnosis box to tick.
Right.
It's the very first step in really understanding someone's experience. To truly grasp what they're going through, you need to be attuned to their emotions, both what they say and, importantly, what they don't say.
So paying attention to everything.
pretty much. Physical behavior, nonverbal cues, how they present themselves, their speech patterns, the content of their thoughts, their cognitive abilities,
Yeah.
all within the context of their current concerns, their lifestyle, and what support they have.
Wow. And this idea of professional curiosity that was mentioned, I found that really insightful.
Me too.
It's about being open to unexpected information, isn't it?
Mm-hmm.
Even welcoming perspectives that might challenge your initial understanding.
Exactly. It seems absolutely key for building that therapeutic connection, that alliance with the individual.
And it also means considering cultural aspects right from the beginning, how the person themselves understands their difficulties, and maybe what kind of help they might prefer.
Precisely. That curiosity helps us avoid making assumptions, helps us truly appreciate the individual's viewpoint within their unique cultural context.
Okay.
Now, when we think about assessment, it's also important to remember that people at different stages of life have very different needs and, well, ways of communicating.
Absolutely. Like when assessing children, for example,
Yeah.
it's crucial to look at their relationships and any history of difficult early experiences, those ACEs.
Right, adverse childhood experiences. Yeah.
They can have such a profound effect on their current and future mental well-being.
Yeah.
And you need to adapt your communication, don't you, to their developmental stage.
Completely. What you discuss with a teenager about, say, intimate partners is very different from talking to a younger child about their best friends.
All right.
And often with younger children, you'll rely more heavily on information from parents, guardians, maybe school personnel too.
Mm-hmm.
It's also worth noting that regression where a child seems to revert to earlier developmental behaviors that can sometimes indicate a psychiatric issue. The HEADS interview technique was highlighted as a useful tool here.
HEADSSS.
Okay.
Yeah. And then with adolescents, privacy becomes a really central concern, doesn't it?
Oh, definitely. They need to understand clearly what information will be kept confidential and what might need to be shared, especially when you're discussing sensitive topics like substance use or sexual activity.
And that HEADS interview is useful there, too.
Yes, it's also a valuable way to identify potential risk factors in that age group.
Okay. Then we have older adults who might face their own unique challenges during assessment. Things like sensory or mobility issues or existing medical conditions. They can all influence the process.
Absolutely. It's so important to be aware of these physical limitations and make necessary adjustments, make accommodations. And as the sources pointed out, there's often a significant interplay between pre-existing mental and physical health conditions in older adults. They really go hand in hand sometimes.
Yeah, that mind-body connection again.
Exactly. So pulling it together, what are the main goals of this psychiatric nursing assessment? Well, it's about building trust, building rapport with the individual, really understanding what brings them in, the current problem. Reviewing their physical health and vital signs is key. Critically assessing any safety concerns, thoughts of harming themselves or others.
White safety first?
Always. Evaluating their mental and psychosocial status. Identifying shared goals for their care, working with them. Developing an initial plan. And, of course, documenting all that information clearly.
And part of gathering that information involves a review of systems, which, as you said, really highlights that important connection between our minds and bodies in psychiatric conditions.
It does.
It was quite sobering, actually, to see the data about the significantly shorter life expectancy for individuals with severe mental illness.
It is stark, isn't it?
And how cardiovascular disease is such a major contributing factor.
It really emphasizes the need to treat the whole person, not just the mental health diagnosis in isolation. The sources also listed medical conditions that can actually mimic psychiatric illnesses.
Oh, right.
Which is exactly why a thorough medical evaluation alongside a psychological assessment is so vital for an accurate diagnosis and ultimately the right treatment.
And lab tests can play a really significant role here too, can't they? Things like thyroid issues presenting like mood disorders.
Yeah, that's classic.
Or abnormal liver or kidney function. Even toxicology screens can provide crucial pieces of the puzzle.
Absolutely. Which leads us nicely to the mental status examination, or MSE.
Okay, the MSE.
This is really the psychiatric equivalent of a physical exam in general medicine. It's a structured way to assess a person's current mental state.
So like a snapshot.
Kind of, yeah. A systematic snapshot. And it can help differentiate between various neurological and psychiatric conditions. For individuals experiencing acute mental distress, an MSE might be conducted quite frequently, actually.
And the MSE covers a pretty wide range of observations, doesn't it?
Mm-hmm.
From their appearance and behavior to their speech, their expressed mood, and their outward emotional expression effect, I think it's called.
That's right. Mood and affect. Also, the content of their thoughts, any unusual perceptions they might be having, their cognitive abilities, and their level of insight and judgment about their situation.
So it's all about collecting and organizing that objective information, what the nurse observes.
Exactly, objective data. And building on that, we then have the psychosocial assessment.
Okay.
This gathers more subjective information, the person's own story, basically, beyond the MSE, to help create that comprehensive plan of care.
So what kind of things does that include?
Well, it delves into their main concerns, the chief complaint, in their own words. Any history of violence or self-harm, substance use, family mental health history, previous treatments they've had,
Right.
current stressors and how they're managing them, or maybe not managing them, their quality of daily life, their personal and social background, their perceived weaknesses, but also their strengths and goals for treatment.
Strengths again? Good.
Yeah, and their cultural and spiritual beliefs are part of this too.
That spiritual and or religious assessment piece.
Mm-hmm.
It seems like something that could easily be overlooked sometimes.
It often is, unfortunately. But the sources really emphasize its importance in how people cope with illness.
Yeah. And it's interesting how they distinguish between spirituality, more that internal search for meaning, purpose, and religion, which is more external, with shared beliefs, rituals, community.
Exactly. And both can have a really positive impact on well-being. They can encourage healthy behaviors, provide a strong sense of community and support, contribute to a feeling of purpose, which in turn can reduce stress and potentially the likelihood or impact of illness.
There's a study mentioned about the baby boomer generation, wasn't there?
Yeah, illustrating that connection quite clearly.
And with our increasingly diverse populations, that cultural and social assessment piece is just absolutely essential, isn't it, for providing care that truly meets individual needs.
Couldn't agree more. It's about understanding individual beliefs and practices, so we avoid making generalizations or stereotypes.
Right.
And it sounds like, unsurprisingly perhaps, individuals respond much better when their unique needs and social circumstances are genuinely considered in their care plan.
Makes total sense.
Yeah.
And the crucial role of professional interpreters when there are language differences that cannot be overstated.
Yeah.
Using family or untrained staff is just too risky.
Huge risks, yeah. Accuracy, confidentiality, neutrality, all compromised.
Okay, so after gathering all this assessment information, what happens?
Well, a really important step is to summarize the key points with the individual.
Okay, a feedback loop.
Exactly. It reassures them that they've actually been heard, gives them a chance to clarify anything, correct any misunderstandings, and it sets the stage for explaining what the next steps will be, builds trust.
And a point that really resonated with me was the need for nurses to engage in self-awareness assessment.
Oh, yes. Critical.
Recognizing our own biases, our own emotional states. It's vital to prevent them from coloring our understanding of the individual's experience, isn't it?
Absolutely. We all have biases. The key is recognizing them. The sources mention the value of clinical supervision, even using recordings of interactions sometimes to refine interviewing skills and spot those blind spots.
Yeah, that makes sense.
And considering the impact of difficult childhood experiences, those ACEs we mentioned, it isn't just relevant for the individuals we care for.
No.
No, it can also affect healthcare professionals themselves. It can potentially influence how we interact with patients, maybe trigger things for us, and even contribute to stress or burnout in the workplace, something to be mindful of.
That's a really important point for the clinicians themselves. Finally, within assessment, the sources highlighted assertiveness as a really crucial skill for nurses.
Yes. Not aggression, but assertiveness.
Right. How does that fit in?
Well, it improves communication, reduces stress, fosters better teamwork, and ultimately leads to more holistic care. Assertiveness is about expressing your thoughts and needs respectfully while also respecting the rights of others. A lack of assertiveness can actually contribute to burnout and a less effective nursing process. And importantly, assertiveness plays a role in preventing errors and improving patient safety speaking up when something doesn't seem right.
And nurses can also empower individuals by teaching them assertive communication skills too, right?
Absolutely. It's a key recovery skill for many people. Okay, so we've built this really solid foundation with assessment. What comes next in the cycle?
Right. That leads us directly to standard 2, nursing diagnosis.
Diagnosis. Okay.
This is where the psychiatric mental health nurse analyzes all that assessment information they've gathered.
Synthesizes it.
Yeah, synthesizes it to identify specific diagnoses, problems, and the main areas of focus for care and treatment. and this includes assessing the individual's level of risk.
Okay. And the sources mentioned using the International Classification for Nursing Practice, the ICNP, for these diagnoses?
That's right. It helps organize patient data, apparently, and can be used for decision-making, even shaping healthcare policy down the line.
Interesting.
And what's also interesting is that it allows for the inclusion of positive aspects of a person's well-being, not just the problems.
Oh, that's good. Like the strengths we talked about earlier.
Exactly. So a nursing diagnosis, what is it essentially? It's described as a clinical judgment about how an individual is responding to their current situation.
Okay.
Their needs, their mental health challenges, their level of risk, and any related physical health issues they might have. It really guides the subsequent nursing interventions and the expected outcomes we aim for.
Got it. So it bridges assessment and planning.
Precisely. And a standard nursing diagnosis usually has 3 key parts, right?
Yes. The structure is quite specific.
First, there's the actual problem, the unmet need.
Yeah.
Then the etiology, which is the likely contributing factor or cause.
The related to part.
Yeah, related to. And finally, the supporting data, those signs and symptoms that provide evidence for the problem. The, as evidenced by.
That's right. So the problem describes the individual's current state, like anxiety. The etiology, the related to part, is really important because it points us towards what we need to address with our nursing interventions. Maybe it's related to situational crisis.
Okay.
And the supporting data, linked with, as evidenced by, gives us the specific clues, the objective and subjective data we observed during the assessment that backs up the diagnosis, like, as evidenced by restlessness, stated feelings of nervousness, difficulty concentrating.
Right. So an example given in the sources was self-mutilation related to disturbed body image, as evidenced by self-cutting, impulsivity, and statements that cutting helps relieve painful feelings of inadequacy. That really pulls all 3 parts together clearly.
Exactly. It tells you the problem, the likely reason why, and the proof you saw. And it's important to remember risk diagnoses, too.
Risk diagnoses, okay.
These are used when there's a significant likelihood that a negative event might occur for someone who's vulnerable. They're focused squarely on prevention.
So things like risk for falls.
Perfect example. Or risk for suicide, risk for loneliness, maybe after a spousal loss. You identify the risk before it happens.
Got it. And then there were health promotion diagnoses.
Yes, these are different again. They're used when an individual expresses a clear desire to enhance specific health behaviors. They want to improve something.
So they're more positive.
Exactly. They're typically phrased as readiness for enhanced, like readiness for enhanced coping. The related to factor here is usually just their motivation to improve, which is already known. And it's supported by defining characteristics showing they are, in fact, ready.
Okay, that makes sense. Moving on from identifying the problems and risks, the next step is standard 3, outcome identification.
Setting the goals.
Yes, setting the goals. This is where we identify the hoped-for outcomes and set personalized individual goals for the person.
And these outcome criteria, they need to be optimal, yes, but also realistic and achievable, right?
Absolutely. They should reflect the best possible level of health and well-being the individual can realistically reach through evidence-based interventions.
And importantly, these outcomes need to show a desired change. They need to provide a clear direction for ongoing care, be culturally appropriate for that individual, measurable so we actually know if progress is being made.
How do you measure it?
Well, you define specific indicators, maybe report sleeping 6 hours per night or attends group therapy twice weekly. Needs to be concrete and achievable given their circumstances, and usually include a time frame, like within 2 weeks. Ultimately, they are centered on the individual and documented as attainable goals.
Okay, so we've assessed, we've identified the diagnoses or problems, we've set our goals or outcomes. Now we move to standard 4. Planning.
Charting the course.
Exactly. This is where we actually develop the strategies and maybe different approaches or alternatives to help the individual achieve those expected outcomes we just set.
Right. And in many settings, both hospital and community, you'll often see standardized tools being used here. Things like care plans, flow charts, clinical pathways.
Oh, yeah?
Often for specific diagnoses. These can help ensure that care is based on the best available evidence, which is good. But it's important to keep in mind that these standardized plans might not always perfectly address a specific person's unique needs or preferences. They need individualizing.
Right. So regardless of the specific tools used, there are some really key principles that guide the planning of care. First and foremost seems to be safety.
Always. Yeah. Safety for the individual, other patients if they're in a shared setting, staff, and even family members who might be involved.
Okay. Then the plan needs to be appropriate, meaning it kind of fits in.
Yeah. Compatible with other therapies they might be receiving, aligns with the individual's own goals, respects their spiritual and cultural values, and fits within the guidelines or rules of the healthcare setting.
Makes sense.
And it absolutely must be individualized or person-centered. This means being realistic about what the individual is capable of, taking into account their preferences, their usual health habits, how they typically cope with challenges, their developmental stage, what they hope to achieve in their recovery, and importantly, the resources that are actually available to them and the facility.
Okay. And finally, the plan needs to be evidence-based. We hear that term a lot.
We do, and it's crucial. It means incorporating the most current scientific findings, trends, and research into the plan.
So not just doing things the way they've always been done.
Exactly. It's about taking what the research shows is effective, combining it with the nurse's professional experience and judgment, and applying it thoughtfully at the bedside or in the community setting. It's about providing the best possible care through this partnership between evidence, expertise, and the patient's preferences.
And the interventions chosen have to be acceptable to the individual too, right?
Absolutely. If the person isn't willing or able to engage with an intervention, it doesn't matter how much evidence supports it. It needs to be appropriate for them.
So just to kind of summarize where we've gotten to, we've explored these first 4 vital steps: assessment, diagnosis, outcome identification, and planning.
Each one really builds upon the previous one, doesn't it? Creating this systematic, but also very person-centered way of providing care in psychiatric mental health nursing.
Exactly. And what's so apparent throughout is that constant emphasis on understanding the individual as a whole person.
Holistically.
And being really sensitive to their cultural background, their values, all through this entire process.
And it's definitely not a static thing, is it? The assessment is always ongoing, and the care plan needs to be continuously reviewed, evaluated, and adjusted based on the individual's progress or lack thereof, and any changes in their needs or circumstances. It's dynamic.
Right, which I guess leads into the later steps of implementation and evaluation we'll cover another time. So as you reflect on this systematic approach we've discussed, focused on deeply understanding the individual and setting achievable goals, maybe consider how these same principles might be valuable in other areas of your life.
Interesting thought.
Yeah, maybe you have a personal goal you're striving for, something completely unrelated to health. How could you apply a similar process of, assessing your current situation, defining your desired outcome clearly, and then planning the concrete steps to actually get there?
It's a framework, isn't it? A way of thinking.
It really is. It's a framework that could be really powerful, I think, well beyond just the healthcare setting, something to mull over.